Well, the leading causes of death in the U.S. are out, and doctors say there are ways to mitigate your risk.
The new data from the CDC shows heart disease, cancer, COVID, accidents, and stroke were the top 5 causes of death in 2022.
Dr. Luke Bradbury is the medical director of UW Health's Comprehensive Stroke Center, and we want to talk about that 5th leading cause. What is stroke, and is it something everyone should be concerned about?
It's an excellent question because we talk about strokes a lot, and it's really hard to define exactly what it is for people who have not had one themselves. Strokes really mean that there's an interruption of blood flow to parts of the brain that can cause then death of that part of the brain, where those neurons, those cells that help the brain function, die. And so there can be 2 main types of strokes, where there's bleeding in and around the brain, or there's lack of blood flow that causes the brain to get damaged there. And so that's what happens with the stroke. And there's lots of subtypes within stroke and a bunch of risk factors that people should be aware of and try and avoid having a stroke.
Before we go to the risk factors, can you tell us what the signs of a stroke are, how to spot them, whether it's in yourself or someone you love?
Absolutely, because it's so important to get to an emergency, to a hospital as soon as possible if you're experiencing the symptoms. So some of the more common ones are weakness on one side of the body or the other, trouble talking, and that might be trouble with slurring your words or getting the right words out or understanding what other people are saying to you, sudden changes in sensation, like you have numbness on one side of the body or the other. And then another important one is to look for problems with coordination. So people will have a lot of trouble moving around, very unsteady in their walking, and that starts very suddenly. And all of those are very good reasons to call 911 and get to the hospital as soon as possible.
And talk to us about those risk factors, and are there things that we can do to lower our risk?
There absolutely are. So there's kind of 2 big categories of risk factors that we think about. One of them is what we call non-modifiable risk factors. And the most important one of that is age. You can't do anything about aging. We all hope to continue to age, and that's just something that's going to be there. But there are a lot of modifiable risk factors that people experience, and we want to get the word out that if you're having any of those risk factors, to really see your doctor and treat them as best as you can. So one of the most important ones, for example, is high blood pressure. A lot of people, almost half of all Americans, have high blood pressure. And we know that by treating high blood pressure and bringing it down into a more normal range, which is often done with medications, we can reduce the risk of a stroke by sometimes up to 35% or so if we can treat that. So high blood pressure, diabetes, and then also lifestyle modifications. We talk about not smoking and eating a healthy diet and that kind of thing are all very, very important.
All right, Luke Bradbury with UW Health, thank you so much for your insight and information today.
Thank you so much for your time.